Okay. Again, thank you so much for joining us for our Systems for Action Research and Progress webinar. This is a series that we host every 2 weeks where we're showcasing research conducted through the Systems for Action program office. And you get to learn in real time with some of our researchers and their grantee teams about what they're learning about their projects. I'm going to take a step back and introduce myself. I'm Carrington Lott. I'm the Deputy Director at Systems for Action. And if you're not familiar with our program office, the Systems for Action is a national research program office funded by the Robert Wood Johnson Foundation. We have been in operation since 2015. We are housed at the Colorado School of Public Health in the Health Systems Management and Policy Department. And one of our main activities at Systems for Action is to develop and release annual funding opportunities, soliciting ideas for testing innovative system alignment interventions and mechanisms. So we're looking at innovative ways of aligning the medical, public health, and social service systems. And all of the projects funded through Systems for Action have many different topic areas, many different focus areas, and many different types of interventions that they're testing. And today, as you probably know, because you registered for the webinar, you're going to be hearing from a team at Salt Lake Community College that was funded in 2024 for a 12-month pilot project testing the efficacy of holistic admissions in their college. And so their project just recently ended, and they have some exciting results and findings to share with you. And I think that's all I'll say for this project now. You'll get to hear all about it here in a second. But I'm going to ask Bob, can you go to the next slide and I'll cover some basic housekeeping items and then we'll move on to the fun part of the presentation. Oh, there we go. Agenda. Okay, so we're here at the welcome. Our presenters here, you can see their names, but you're going to get a more in-depth introduction here in a second when I hand it over to the team. And then we'll have commentary from Cassie Keene, who works at the university in the Office of Sponsored Projects, speaking about the importance and relevance of this project for the community. And then we'll save time for Q&A at the very end. So if you have any questions at any point during the presentation today, please locate the Q&A box at the bottom of your screen, pop your question in there, and we'll make sure that we save time to address those at the end of the presentation. I think the only other thing that I'll mention is that all of these sessions are recorded. So we do share the recording as well as the PowerPoint slides and any other resources shared during today's presentation after the webinar. So be on the lookout for that. And with that, I think that concludes my intro and some housekeeping. So Bob, I'm going to go ahead and hand it over to you and the team.
Thanks, Carrington. Good morning, everybody. Thanks for joining us, or afternoon if you're on the East Coast. By way of speeding things along, I'm going to introduce the team, who each one will present individually. My name is Bob Pettit. I'm the Dean for the School of Health Sciences at Salt Lake Community College. My co-investigator is Dr. Stephanie Richardson, who serves as the Associate Dean for the Division of Nursing at Salt Lake Community College, and she has a long-spanning career in multiple areas of nursing, from graduate doctoral level all the way down to now being an Associate Dean at a community college. We're pleased to have Sharon Up on our team. She's the Director of Health Science Admissions, Marketing, and Outreach. And she comes to us by way of the School of Medicine at the University of Utah that did some of the early work on holistic admissions for medical schools. And so we decided, let's do this at the community college. Our community partner is Mindy Bateman. She is the Director of Crossroads Utah Area Health Education Centers, better known as AHEC to those of you who are in the field. She does a lot of work with high school students that are looking to break into healthcare fields, and gives them lots of advice and ways to go about how are you going to do that and how are you financially going to make it happen. Another co-investigator is Matt Harris. Matt Harris is the Associate Dean for the Division of Health Professions. And prior to that, Matt was the director for our radiological technology AAS degree. Matt actually was one of the first people to hop on. His thesis was on soft skills. So he's like, yeah, I would love to get involved in work on holistic admissions. And so RadTech was one of their first majors to jump in on this topic. And finally, Cassie Keene, who's in our office of sponsored projects, she offers a unique lens in that she is now our post-award sponsored projects officer, but she has spent a lot of time volunteering and helping out with the study. And I don't want to steal her thunder. I'll let her have that time to speak to some of her observations. So at Solid Community College in our health sciences school, we have about 12,000 students that want in, and we usually have about 1,000 students that actually get it. So it's a high demand majors, and we have a very diverse applicant pool. I would say roughly 70 to 80%, and that may even be a low figure, are first gen students. And so we look at how they were admitted. Traditionally, we relied on metrics such as GPA and standard testing scores. We really didn't measure non-academic factors. And so the result shown in bold here is that most of the students that were admitted were mostly white and high socioeconomic status. We just decided we've got to do something about this, or we need to level the playing field. And the literature suggests that holistic admissions is one way to do that. We still have relatively high GPAs. We eliminated bias by getting rid of standardized testing and replaced that with holistic admission metrics. These tap into non-academic factors. And as a result, you can see we are, in theory, we should have a more diverse population with a larger range of socioeconomic status and more first gen ed students admitted. However, there's a gap in the knowledge that we don't have a lot of data to support whether or not this will actually work at a community college, hence the S4A funding. A little bit about traditional admission standards. GPA, they were great, but if you look at nobody from my view or above would say we have a problem. We don't have a problem. We have really talented majors in our degrees. The average GPA was a 3.9 for dental hygiene and rad tech. But it did make us question, well, who do we really have in here? Some of those 3.6 GPA students could be pretty good. We're just not giving them a fair shot. We need to measure other things. GPA alone disenfranchises BIPOC students and also disenfranchises low socioeconomic and first-gen students. With standardized testing, we see equal problems. The proof in principle of why these are racially biased was COVID. During COVID, we couldn't get students into testing centers. And so universities and colleges were doing test optional policies. Now, who's really wanting to opt in on taking a standardized test? Nobody, right? So when we saw that happen, we saw more ethnically diverse applicants getting admitted. And in one case, a study by Primrose that even when you statistically correct it for first gen age and high school rank, the TEAS, which is a very common test for admission to nursing, discriminated against African Americans. So with holistic admissions, what we're doing is we're measuring non-academic qualities, things such as durable skills, cultural competence, compassion, empathy, and ethical decision-making. These were originally conceived to improve the diversity cap. There are more advantages beyond that, being a more inclusive admissions model, and more importantly, screening away people who simply lacked the soft skills integral for effectively delivering healthcare, the so-called 10% of the students that consume 90% of your time. And if you're in higher ed, you know exactly the students I'm talking about. So some of the metrics we'll be looking at this morning, the multiple mini interview or MMI, the situational judgment testing, SJT, and standardized video interviews or SVIs. We have a fly in our soup. While we were rolling this out, the Supreme Court reversed affirmative action. Basically, it said You can no longer legally consider somebody's race in terms of their admission status. And there's groups that came out with model legislation that reached all 50 states. And we'll see the results on this next slide of what happened. As of November 2025, so the Chronicle of Higher Ed, bless their hearts, they have this ticker that monitors the legislation. There's been 136 bills that went out targeting EDI. How did all these states know how to do it? It was Claremont Institute. You'll see 14 are now in law, and those are the dark green states. Here is Utah. We are one of them. So you would think to yourself, oh no, how could we do holistic admissions with these EDI legislation? We're doing it in one of the most conservative states in the United States. So some of our research questions are as follows. Can we effectively replicate holistic metrics used in graduate programs for competitive health science education programs at community colleges? Do holistic metrics change the demographics of people admitted? And do they jeopardize academic performance? The so-called deficit thinking. Oh, with holistic admissions, you're letting in the dumb kids. No, that's not what's happening at all. Mindy, you're up.
Okay. Thanks, Bob. So you can see as part of our project, we had 3 different groups of partners that we brought in. So under the medical system, we had our Utah Hospital Association, the Utah Health, and then Intermountain Health and HCA Mountain Star, which those last 3 are the 3 largest medical groups here within the state of Utah. And then under the public health systems, we have the group that I'm over, the director of the Crossroads Utah Area Health Education Center, or AHEC, and then the accrediting bodies for our programs. And then our social system is our College General Counsel, Anastasia Morgan, which, as Bob just went over with our anti-DEI legislation, we needed to ensure that we were staying in compliance with all of our current legislation. Next slide. Next slide. So this is the different roles that each of our partners plays. So some of our partners that came on, they serve on our program advisory committees, review our curriculum admission standards. Some are donors. Some work at our clinical sites and act as preceptors for our students as they're out on clinical rotations. And then a lot of them served as interviewers for the multiple mini interviews that we do in the 2 programs. With Crossroads Utah AHEC, one of the things that we get to do, which is really exciting, we bring our high school and early college level students on campus. We have several programs that we run with them. And so to start, we talk to them, ask them who knows about, the situational judgment test, multiple mini interviews. A lot of them have heard about it, but don't know a lot about it. So we're able to introduce the concept to them, kind of educate them about this concept. So we know that there are several programs and schools that have had these tests required or these interviews required in the past that have now changed that to make it more of a requirement because they've known that they haven't educated their pipeline students going into that, and it hasn't been as effective for them. But with this partnership, we know that educating our pipeline of students and getting them prepared, that we'll have much better success with that. So this is one of the reasons that Crossroads AHEC was brought into this, is just to really prepare students for the development of this. So next slide. So again, we use a practice test. We pull a test from the AAMC that's on their website. It's their practice test. We hand this out to students, and as we hand it out, we're like, okay, we're going to have a test today. And the students, of course, get that test anxiety look on their face. And we give them some time. We usually just do 6 questions with them, which we know that the test that the AMC is a little bit different than the test that we've implemented here, because we keep our test, and I think Cher goes over that later, separate. It's very different because we don't want to share our test here. But we'll go through that. We'll give them time to go and take the test. And then we go through it together. We go through the answers, we talk about it. And then at the end, it's really exciting to have them kind of see their anxiety level go down. Like, oh, okay, yeah, I don't have to have medical school knowledge or nursing knowledge or rad tech knowledge to go through these. And it really is just about looking at some of those, the empathy and critical thinking skills to go through these. Next slide. So with that, after we go through some of these different opportunities and talk about MMIs and SJTs, we've been doing some evaluation measures with our students. And each time we do a program and then evaluate, we're changing a little bit of how we're doing it to make sure that we're doing our prep work with students and making those changes to make sure that we keep making our program more effective and preparing them to be able to go in so that when they apply for our programs here at Salt Lake Community College, that they're really prepared to be able to take those tests. And next slide. And then long-term success, of course, the grant's been going for about a year. Crossroads AHEC's been here for about 26 years, so a little bit longer. We have a success rate of about 71% of our students who matriculate into health science programs through our regular Crossroads AHEC programs. So we're hoping that preparing the students and going through the MMI and the SJT process, that we can see that success rate increase as most of these tests are being implemented, not just here at Salt Lake Community College, but other programs here within the state and outside the state, that prepping our students in these programs will help them get into more programs. And next slide, and I believe I toss it to Cher.
I'm up. Thanks, Mindy. Great to be here, everybody. As Bob mentioned, various states were hit with anti-DEI legislation. And so as we've rolled out this holistic admissions process, we've had to do so carefully, consulting with our legal representative. Thank you, Anastasia Morgan, for helping us have the correct and appropriate verbiage so that we can execute this holistic admissions process. The multiple mini interview, the MMI, it originated in medical schools admissions. It's a short interview with questions and responses with multiple interviewers. And we'll talk a little bit about what that looks like today. It involves using interviewers that are not directly involved with the program to reduce bias. In other words, we don't have faculty performing interviews or faculty from the program performing interviews. The external partners who help us with this process are signing an NDA so that we can ensure privacy with the questions and that students can all have the same opportunity. We utilize an IDI, Intercultural Development Inventory test. It's a survey and a method for guiding discussion on cultural sensitivity. It was conceived to evaluate Fortune 500 execs and representing U.S. companies internationally. It's adopted by our admissions personnel to facilitate intercultural assessment and debrief prospective interviewers in an effort to reduce cultural bias. With this intercultural development inventory, if it does nothing more, it brings cultural bias to the attention of the interviewer and allows them to have some self-reflection. What this looks like is the IDI is it's sort of delivered as a sort of a personality test with various questions. And then you get your results, which plots you somewhere on this spectrum that you can see on the screen now. The spectrum of cultural sensitivity or intercultural understanding can range from denial on the left there, which represents someone who has no awareness or desire to be aware of cultures that are different than their own, or maybe their own culture. And the spectrum goes all the way to adaptation. And this is an individual that we all strive to be, that we can gracefully navigate different cultural situations and do so courteously and respectfully. The procedures of the MMI process go as follows. We operate with transparency with our admissions process. In other words, if the students applying to a particular program are going to be having a standardized video interview or MMI interviews or the GPA ranges that are necessary, these are all published well ahead of time, so the students know exactly how to succeed, or at least what to expect as they apply to these programs. We develop metrics. We establish domains. In other words, what qualities are we looking for in our applicants, in our student applicants, whether it be compassion or trust or empathy or sympathy, things that are so critical in healthcare for the bedside manner. And that thankfully we've been able to assess our applicants for these durable skills or soft skills to bring in the best prepared and best suited students into our programs and to hopefully create the strongest employees as they enter the workforce in our region. We solicit interviewers and get them from the community, from our community partners, and sometimes from the dean's office or staff. There's a cultural bias training, as I mentioned. The IDI is given to all the interviewers, and a debrief and a growth plan is offered from the IDI company so that individuals who want to continue on the intercultural spectrum, they can, and they can at their own pace and their own rate. We schedule the MMIs, we conduct the MMIs, and we surveyed the students and the interviewers to determine what the experience was like for them. Was it positive? Was it negative? What went well? What was a struggle? And we use that feedback to tweak our approach in coming years. The MMI is evaluated by secondary admissions staff for item analysis for consistency, and we gather metrics and information from this process so that we can determine the effect or impact that our methods are having. And then we are able to use those metrics again to determine the impact that we're having and how we will approach it in the future. What the MMI looks like is the applicant signs up for a 1-hour interview. If they're late, they forfeit their application. It begins with an orientation where the students, usually 5 at a time, are told what to expect. They enter a room, there's no notes, there's no telephones, there's no other communication permitted. And the students encounter during this hour 4 different ethical scenarios, healthcare related ethical scenarios. And they respond to those scenarios. They're given 5 minutes. And the interviewer scores the applicant based off the domains that we're looking for. Are they exhibiting, with whatever their response is to this ethical scenario, are they exhibiting compassion, empathy, safety for their future patients? So they read the scenario for 2 minutes, and the person explains how they would, as a person, respond to the scenario. There's really no way to prep for it. There's really no study guide for it, other than fostering the qualities and values that we hope to have our graduates exhibit from our programs.
Thanks, Matt.
And Cher, I think you're up.
Thank you. Our standardized video interview replaces self-reporting or autobiographic narratives that are susceptible to plagiarism or poor discriminant validity. You can pass along platform support outside of the institution for creation or training and external scoring. Policies are in place for ADA compliance, security for protection. You need to make sure to budget time for building and customizing the standardized dashboard, coordinating with your internal institutional technology personnel or management. That can take quite a long time to work with your IT team. And then also in the financial processes, getting contracts set and procured, setting up indexes and payments of the contract before being able to proceed in creating the platform. The SVI replaces application essays. It is done remotely on the applicant's computer with a camera. A practice interview familiarizes the applicant to the portal, and the students receive the question and are given about 30 seconds to prepare. Once the recording is initiated, there is no stopping or do-overs. And use of the third-party platform lightens the staffing load. They rank the applicant's answer and they provide analytics on the back end, and the cost is about $15 per applicant.
So I'm just going to hop in here to show why we abandoned the essays. You can see on the y-axis the total score, and then the essay, there was really poor correlation between the the metric and whether or not they got in. To the right, you can see the frequency of scores, and the central tendency was similar between those admitted versus those that were in the alternate group, although statistically significant. Essentially, what this meant was somebody could get a really poor score on the essay and still be admitted to the program, or get a really high score and not get admitted to the program. The essay wasn't adding value, so we thought the standard video interviews would be a suitable replacement, and in fact, it was.
Some of the highlights that we saw for our dental hygiene SVIs, the average to completion was about 12.7 days on the platform. 40 out of 40 or 40 out of 40 applicants completed their assessment, so at 100%. They provided a 4.55% rating out of 5. The average completion time was about 10.3 minutes. There were no integrity flags, meaning there was nothing indicating that they had attempted to cheat or caused issues. And 2.5% of the applicants received some kind of tech-related assistance through the third-party platform. Reviewer highlights. There were 5 competencies in total. Inter-question reliability was not available. The average interviewer rating was a 1.98 out of 3, and 100% of the reviews were completed. Applicant experience, we show a 4.48% average rating out of 5. The applicants' reviews were exceptional. One of those would be that I really enjoyed this interview and the way it was set up. I do wish there was a little more time than 30 seconds to prepare, and then also a button to get everything started if you didn't need all the preparation time. Interviews are always nerve-wracking, and I don't love the idea of an online interview, but this was surprisingly painless and easy. And Stephanie, over to you.
Yeah, it just always takes me so long to unmute. Forgive me. Now, the situational judgment test tapped similar but not the same constructs as the MMI, and we chose the SJT for nursing because it's such a large program. We admit every term, so that includes summer. It's a 4-semester program, so we always have 500 students that we're dealing with. We couldn't do interviews for the number of applicants that we have for our program, and we sure couldn't do it 3 times a year. So a test, paper, in the olden days, we called them paper pencil tests, but it's a ranked choice, multiple choice test. We were very concerned about security, and I will say that Cher is the queen of this, and she set this up so that our items were randomized, and we have a process for ensuring that test taker is the applicant, and the exams are proctored via video camera live, and the other browsers are locked down, and we don't allow photos or downloads or screenshots. We can do all that because we require testing in a Salt Lake Community College Testing Center with rare exceptions. Next slide, please. The SJT originated about 50 years ago, mainly in the military arena. The business adopted it. The validity was all internal, and the domains that were tested were pulled out of job descriptions. And currently, it's fairly popular for filling administrative positions, customer service, and of course, medical admissions. And in our study, we followed our leaders in the military and business, and we wrote very low fidelity scenarios with multiple choices, and we were really asking, will it be effective for screening prospective nursing candidates? Next slide, please. The domains from business, are you adaptable? Are you a leader? For medicine, the domains that are tested for are empathy, integrity, and resilience. I would add teamwork. From my read of the AAMC, they're also testing for the ability to work in teams. And we decided to use the Houston competencies as our framework. So it's quality and safety and nursing education. So there are the competencies right there. It seemed to fit with our real world scenarios. So we were very happy with that framework. Next. So here's the scale that responses are rated upon, and very effective gets 4 points to the right of your screen. And if this is if what you are selecting is likely to be quite ineffective, that gets 1 point. So here's a sample item. You and a friend are in the supply room. You see your friend taking office and first aid supplies and putting them in their backpack. They look at you and say, "This place owes me." And so there are the foils. And the best one is B. You just leave the room and consult a mentor. For an experienced nurse, that's probably not the right answer. But for someone just starting out in nursing, we call these are applicants, that's the right answer. All the way down to one, reply to them, "I know, right? Companies expect a certain amount of loss." I'm hoping you can see why that would be the really ineffective answer. Next slide, please. For procedures, I think I'm back to share, or is that Bob?
I can hop in here, Stephanie.
Would you?
Yeah,
Yes.
sure. They're very similar to how we rolled out the MMI. Probably the major differences were the windows for getting into the testing schedule. Some of the stuff that we had to do with coordinating with the testing center, a little bit different from the MMI. And then all the other items are fairly similar. I'm going to pivot back to the results now. We've got through our methodology. What we find with the SVIs and MMIs, we observed very good internal reliability. So for the SVI, remember this is only 5 items. So an alpha of 0.67 for RadTech and 0.72 for dental hygiene. Those are outstanding internal reliability metrics. Then the MMI, these are 30 items. And so we would expect to see them high, but I was truly shocked to see just how high it was. And I think that's a testament to the work of Cher and her team reviewing and going back and forth. These are the frequency distributions for the MMIs or multiple mini interviews. On the left is dental hygiene. On the right is RadTech. You can see there's a fairly normally distributed scores for each of those tests, and the statistic for normality was not statistically different. So that's a very good sign. How these metrics did in terms of screening who was admitted and who was not admitted, we see here GPA was not statistically different for RadTech. Remember that, again, we were worried about so-called deficit of holistic admissions. Granted, 3.8, 3.9, these are very good GPAs. With RadTech, all of the applicants are so high. What we did observe was statistical significance for the SVI and the MMIs for those admitted versus not admitted. If we go to the bottom table, this is dental hygiene. Here, the GPA was significantly higher for those admitted versus those not admitted. People would say, "I'd love a 3.4." Unfortunately, it's so competitive. A 3.78 is what got that person into the program. You can see what's labeled as D are the Cohen's D or effect size. These are ginormous effect sizes. So everything, the SVI was statistically higher for those admitted, the MMI statistically higher for those admitted. We have scatter plots that are shown here. To the left is the SVI, that's the video interview, 5 items. Very high correlation between that. And on the x-axis is the composite score of those admitted. Similarly, MMI with the composite score on the x-axis. This is rivaling what we see in medical schools that's published in the literature. And of course, we would expect the higher your GPA, the more likely the higher the composite score. What about rad tech? Similarly, the SVI, the higher your SVI, the more likely you're going to have a higher composite score. MMI was the same thing, a little bit quirky with the GPA, but remember, our rad tech students are very homogeneous in their grade point averages. So here are the results for the situational judgment test. I'll pass off to Stephanie.
Oh, I was hoping you would just go on, Bob.
Well, I can at least say
Yeah,
again, with the MMI, it's very normally distributed, a good internal consistency, reliability. Now I'll turn it over to Stephanie.
Yeah, we were happy with the normal curve. And then, of course, we looked at who's admitted and who's not admitted. So nice big sample sizes. So we were able to detect differences because we had a lot of powers. Yeah, so the science GPA, which is a major indicator of the ability to attain your degree, was high for those admitted, 357 compared to 338. That difference was statistically significant. The situational judgment test score was also different between the two groups, and you can see that very low p-value. And the composite scores were different between the two groups, which makes sense because we use those to create the admissions pool. And for the scatter plots, there's a high relationship between the SJT score and the GPA. And if you look at the GPA, you'll see a clustering around the 4.0. We have a lot of students who graduate with a 4.0, which accounts for some of the scattering you see here. The composite score compared to the GPA, not particularly significant. And if I'm reading that right, and I am. But the SJT and the composite score were related with an R value, very small R value.
Okay, we'll talk about a little bit about our basic flow and what that looks like for the admissions processes. We have our pipeline of students. Right now, that's roughly about 12,000 students who are looking to get into 8 of our healthcare programs. Those students submit an application, and the admissions office does our initial screenings. When the application sessions close, we will take the top percent, which is usually 2 times the capacity of students that will be considered in moving forward for MMIs, SJTs, and or SVIs. Those that do not meet the top percentages are excluded and denial letters are sent out to them. Students who move forward in those processes will be notified, and then they move through the process before notifications go out about what their final status is in terms of admissions. They are surveyed on the process so that we can get sincere responses from them. The students are then admitted into the program, and they initiate background screenings, immunization verifications, and things such as that. For those students that were not admitted but came in just under, they are placed in our alternate pool, and then we will have students that did not make it into the program or on the alternate list, and they will receive denial letters. Once students are fully verified for full acceptance into the programs, they're turned over and clinical placements are set up. Some of our software support that we utilize would be My Success, where we work with our pipeline student rosters. Our application system is through Enrollment RX and Salesforce. We download our information and rank order everything in Excel, and we utilize scheduling software such as SignUp Genius. Task testing platforms and third-party vendors would be items such as Kara Talent. And then we utilize survey software and Complio for our background and compliance requirements. Some student testimonials that we had back in terms of our new holistic admissions processes. I feel like I am being heard. If we're up to my GP only, I would never get admitted. I applied twice before and finally got in. Thank you. And this has been something we've seen consistently, that students had applied over and over again, but were never seen going through this process. They were brought into interviews and they excelled and they were accepted. Honestly, I thought the process was great. That was my first time doing an interview in that manner, and it was so much more relaxed feeling than your typical interview. I felt very comfortable and more confident during this interview instead of a traditional interview. I'm grateful for the opportunity you've given me. Passing on to the interview phase was nerve-wracking, but I found the MMI format to be well structured. It allowed me to showcase my true self comfortably, and I appreciate how organized and straightforward the entire process was. I loved it. It was interesting to respond to these situations, and I loved this interview process. We get a lot of fun responses from students on this. In summary, holistic admissions allows for considering non-academic attributes and characteristics. From a legal viewpoint, holistic admissions are best described as inclusive. Essays, SVIs, SJTs, and MMIs have emerged as popular holistic admissions techniques. Always safeguard your metrics, treat everything as if it were as valuable as gold, and describe holistic admissions to prospective students.
All right, this is where I get to invite Cassie. She got 1 day notice. And I basically just said, you know what? Why don't you take a few minutes and just say what you said to me yesterday on the phone, because it was perfect and unrehearsed, unscripted. So I turn it over to Cassie.
Thanks, Bob. It is honestly my pleasure to provide comment on this process and this team because I think it has been so exceptional and very telling. So, I mean, technical skills are replaceable and soft skills are not, right? And I think the holistic admissions process, and particularly what I have witnessed with the MMIs, really allows for the kind of like finding of the perfect combination of candidates, right? So it's just been fascinating. And the time and effort and organization that has gone into this, like huge shout out to this team and Cher in particular. This thing literally is time to the minute, as Matt talked about, right? I mean, it's your 5 minutes here, 2 minutes to read this, 1 minute to see this. It's astonishing to see it in action. So I participated in MMIs in multiple different instances and in some different roles as well. And through those, I think the common thing was really just to be able to see the depth of candidates. And I think also holistic admissions and the MMIs really allow you to kind of choose the right candidates for the right time as well, right? Because again, as this team has alluded to, you're really focusing on some of these skills that you're not necessarily seeing on paper, right? So you're able to identify leadership and resilience and ability to change and empathy, things that are just so valuable in so many areas of life, right? Particularly healthcare. So I think that the MMI really allowed, folks to see things that just, again, were not on paper. And so after MMI kind of happens and everybody is scored and kind of the team is connecting and just kind of chatting together. I can't think of words, but we're processing. Oh my gosh, I forgot the word processing, everybody. But processing together, right? And to hear different folks just kind of highlight the things that stood out, the creativity of answers, right? Again, and we're not talking about like the most extroverted students who were standing out, right? We're talking about things like kindness and attention to detail, right? And quiet leadership. So just a really phenomenal process. And I think it's so telling that so Salt Lake Community College's president a few months ago, after seeing what this program has done in just a short amount of time, had decided to use the MMI process as part of the interview process for a really high level position at Salt Lake Community College, which one is telling in and of itself, right? That this is such a valuable tool that the president of our institution was like, hey, this is going to be part of us choosing one of the most integral leaders on our campus, right? And so I had a chance to participate in that as well. And the MMI does not lie. The candidate that stood out was the candidate that was ultimately chosen. Again, after everything was scored, after we're processing as a group at the end, the candidate that hands down everybody was like, this person is really rising to the top. That through the rest of the interviewing process, that was the candidate that was ultimately chosen. Again, because we had an ability to really kind of see this beautiful combination of these technical skills, but also these soft skills that we need in this moment. So, overall, as an outsider, I just commend the commitment that this takes. I think institutions, we're dinosaurs and it takes a long time to turn around dinosaurs. But this team has proven that if you can do this at Salt Lake Community College in Utah, you can really do this anywhere, right? Because wow, the results are going to be incredible. The candidates that you're going to find, and again, the skills and the attributes really needed for a particular time, particular climates, you get to decide what that looks like. So what a fantastic and amazing process. So that was a little bit of my experience with it, and good job, team.
Thank you. Thank you so much. I know we've thrown a lot at you, and if you have individual questions that we don't address in our Q&A portion, feel free to email me and I can put you in touch with anyone on the team. And no, you may not steal shares. She's spoken for. With that, we'll go into questions and I'll turn it back over to Carrington.
Thank you so much for that presentation and for some really important and interesting findings from your project. It's been a joy to get to work with you guys. And I hope no one here is here to poach share from you. Okay, I'm going to ask the first question, but if there are any other questions from people that are here with us in the session today, please put them into the Q&A box. We have plenty of time to address them. But I think my first and kind of easiest question is just, what are your next steps? What are you planning to do now that the project is over and you have these findings?
Bob, do you want me to?
Yeah, please jump in.
So our next steps, our holistic admissions have grown. We have 5 programs who are now going to be participating in the SJT, where we just started with nursing. For SVIs, we now have 3 programs. And MMIs, we have 5 programs. So as our programs have watched this process come on board and they've seen the positive results, they've said, hey, we want to get involved in this too, and what does that look like? And so we're writing those for each individual program. Each one has different needs. We're building more of our holistic admissions components. We're getting more of our community partners involved. And so this was a project that started small and has now greatly expanded, and we expect that it will continue to expand.
Wonderful. Thank you, Chair. I'm going to ask the next question, which came in from Patricia, but I know that your team has received a lot of interest from other community colleges and the model that you're using and what you're learning from this experience. So I think it kind of ties into Patricia's question about your plan for dissemination of this model. And could you kind of tie sort of your conversations you've been having with other community colleges into your plans for disseminating this?
So I can answer that one. I just found out last week we were selected as one of 8 community colleges to take part in a Pathways grant, and it's really aimed at exactly what we are doing here. How do you get somebody trapped in, for example, a CNA credential, get them through into the RN program? And so I've already reached out to the deans of those 7 other community colleges to say, hey, let's have a conversation about how you might use some of what we've learned over the last year, thanks to the S4A group and Carrington and your team. I, so that's the answer 1. Answer 2 is I'm going to come out to Denver and learn more about D&I because it's so new to me. So I'm looking forward to your group's work there. I know who already launched that heart.
For everyone else here, we're having an all grantee meeting where we're having everyone convene in person in December. That's what Bob is talking about. And we will have a specific session on dissemination and implementation. So I know we have had conversations with this team about maybe supporting with an implementation guide, trying to think through that. So Patricia, stay tuned. I see
I
a
would
question.
jump in here and say,
Please.
Carrington, Bob's a little modest. We promised you 2 articles and he's already written one as the lead author and it's under review. And the second one is being edited by Bob and me, and we'll submit that to a nursing education journal because they'll be all over this.
Perfect. Thank you, Stephanie, for plugging that. For everyone here in the session today, we'll make sure to send those articles to you once they're published. But they will also be in our Systems for Action newsletter and on this group's project webpage on the Systems for Action website. I'm going to move on to the next question that came in from Sheila. That question is, do you have any reflections regarding the extent to which this holistic process might be associated with an increase in diversity and inclusion in the admissions process? And then she had a follow-up statement that said, for example, inclusion of the disability community and perhaps other marginalized communities.
If anyone else wants to weigh in, I'm happy to answer that, but if there are others.
Why don't you start, Bob, and
Okay.
I'll add if you need to.
I think one lesson we learned was just by removing the T's, move the needle on who was admitted in that. Even if you just simply eliminate some of your racially biased practices, that can make a difference. In terms of the other question on inclusion of other marginalized populations, I believe we have 25% of our students in the program right now are on some form of an accommodation. And so Stephanie, you might want to chime in on what you're doing with that. Or
Well,
plan
we're
to do.
running a case, but because accommodations are really important to us, and we focused on compliance. But with that number of accommodations in a student body of 500, you can imagine that the faculty and staff have been very busy. I would say it's a good problem to have. Honestly, if you want to be graduating caregivers that have all those domains we're talking about, and also are really smart. So the GPA is important, but also patients want to be cared for by people who look like them and have similar life experiences. So that's a lot of the population that perhaps has an accommodation. Eliminating the T's made a huge difference, and that occurred prior to this S4A project. So at one point we had 80, and which surprised us and caused us also to scramble to meet their specific needs. But I think that eliminating that paved the way for us for this project.
Logistically, we've
That's
met
all.
with our student affairs VP, and they agreed to fund half a position to assist faculty with implementing accommodations because it's been such a huge ordeal. So we're relieved that our people are reacting to in a positive way how to accommodate people with disabilities.
Thank you both. I see that we have another question, but I'm going to jump in here as moderator and ask another one. Your team was still able to stay on timeline and implement this method into your community colleges. And this was despite the rollback of DEI in a pretty conservative state, as you mentioned earlier in the presentation. So I'm wondering if you could speak to some of those relationships that you had prior to implementing this and how you think that you were able to navigate some of those barriers and still successfully be able to implement it and stay on timeline.
Sherry, you might need to handle that one, your work with Anastasia.
Yeah, I think a big part of it was our legal team, Anastasia. She's fantastic. She's very on board with what we were doing, and so she jumped in all over it. And she was quick to review and provide feedback, and we were able to take that back to our programs and say, okay, we need to make these changes. But really, honestly, in the process of this and looking at it, we were looking at it from the perspective of what our community partners' needs are. What type of student are they looking for, and what type of those traits do they need to possess? And because of that, as we were going through this process and how we were looking at it, right, in focus of this is what the community needs, we were able to successfully continue our process even with the new law because it was based on those specific needs. It wasn't based on anything else. And in doing that, it allowed us to move forward even with the new law and not have to step back and have to rewrite. That's just how we did it. And it was successful. And that's why we were able to keep our timelines and keep on going.
And I'll say that Cher is very careful in the language she uses. Very careful.
As we all have to be these days, unfortunately. I know we have 2 minutes left. I think we can address this one pretty quickly. And Stephanie, I saw that you typed out your answer, but I'm going to go ahead and address it out loud just in case others want to hear the response. Can you please speak on the retention of students and progressing to successfully completing the programs? Stephanie, do you want to take that one since you responded to it, or do you want to kick it off to
I
another?
jumped right in, sure. 95% graduation rate, so program completion. 90% of our graduates have a job offer or a job in hand prior to graduating, and 86% pass the NCLEX RN licensure exam on the first try. So we're really happy with the quality of our students. I'm happy with quality of faculty, but those are our prime indicators of a quality program. So everyone's happy.
Wonderful. Thank you. Okay, I think with that, we've got 1 minute left, so I think we can go ahead and close out. But thank you so much for attending today and listening to this team's work and what they're learning. And thank you so much to the team for coming back and presenting a second time in our Research and Progress Webinar series so that we kind of know how you closed out your Systems for Action project. We will be following up with the recording and the PowerPoint slides from today's session, and we will make sure to share with you any future publications or products that are developed and released from this team. So thank you again, and I hope everyone has a wonderful rest of their Wednesday.
Bye.
Thanks.
Bye.
Take care, everyone.